Emergency medical teams are a group of health professionals who work together to care for people who've been affected by disasters. Of course, it's key to get emergency medical teams to the field as quickly as possible so that they can start helping people and saving lives. But we also know that in emergencies where many people are affected, that one medical team alone, of course, cannot do it. So we have a situation where many are coming together. To give you an example, after Haiyan, we had up to 150 medical teams that were on the ground, and they came partially from the Philippines and from other countries.
At the airport, it's so chaotic. There's a lot of confusion where the teams would be going, where they have to coordinate. You know, it's really a big lesson. So we have to come up with this system so that it will be more organized action. This is actually a training on the Emergency Medical Team Coordinating Cell. We have 30 participants coming from our DOH Central Office and from the regional offices. We have requested this training from WHO because this is a very important training, especially so now that we are having so many disasters, big disasters. We are simulating the big one, the earthquake 7.2 in Metro Manila and nearby provinces of Region 3 and Region 4A. In any disaster, it's not really just one agency handling it. We have to coordinate with other agencies. Like if there's a need for this international humanitarian assistance, then we have to activate what we call the Philippine International Humanitarian Assistance Cluster headed by the Department of Foreign Affairs. At the airport, they have to set up this what we call PHARC, or in the UN term is the Reception and Departure Center. The OCD is also here because they are the executive officer of the National Disaster Risk Reduction and Management Council that integrates and coordinates all the actions of the different agencies. We would want them to also be familiarized with what we are doing at the health sector so that the coordination when it does happen that there's a big disaster, everybody understands what we're doing. We would be speaking the same language, so the operation would be better.
If they are not well coordinated, they are stepping on each other's toes, and this can actually add to the chaos on the ground. This is a huge opportunity because if they are well coordinated, they can be complementary to each other and they can make a huge impact. So coordination is really critical.
I do believe that with this, they would be better equipped to be managing the entire operation when there is a disaster. Of course, not just the actual operation, but even preparing for what needs to be done when something happens and when there's a need to activate the EMTCC and to really operationalize it.